My name is Dr. Jo Sahar. I'm a rheumatologist and I run the Monash Scleroderma Clinic. I think one of the first questions people who are diagnosed with scleroderma ask me is, what is scleroderma? Many people have never heard about this disease until they're diagnosed with it, and they want to know how it will affect them, what problems it might cause them, in particular what issues it will have for them in terms of their ability to live their lives normally. So will it affect their ability to work? Will it affect their ability to be a parent? Will it affect their ability to perform normal everyday activities? I think one of the other things patients are always very interested in is why have they developed scleroderma, and particularly with reference to whether or not it might be a genetic condition and whether or not it might affect other members of their family. I think when I first see patients with scleroderma, I think one of the most important bits of advice we can provide is to understand that every patient with scleroderma is different and that we need to treat each patient as an individual. So while some patients can have quite a number of organs involved with their disease and they can have quite severe disease, many patients have much more mild and limited disease. To see us regularly, at least once to twice a year, to talk to us about new symptoms so that we can detect any new disease or problems, to screen for heart and lung disease. We now have a number of good treatments available for scleroderma, for various aspects of scleroderma, and on the whole, if we can detect that disease early and institute treatment early, we see better responses and better outcomes. There can be quite varied impact on patients' overall health. Scleroderma can affect different patients differently, and in many patients it can affect their skin, their joints. It can cause quite disabling gut symptoms and lung disease, and less commonly it can affect the heart and lung and kidneys.
Hi, my name's Kathleen Elford. I'm a registered nurse. I work at Monash Medical Centre and I've been in this role as the scleroderma clinical nurse specialist for 11 years. It's a role I've come to thoroughly enjoy and feel really privileged to do. I think on a daily basis, one of the biggest challenges for scleroderma patients is the loss of independence. So the loss of hand function, the loss of strength, the loss of dexterity, the inability to grip things and to achieve things. For a lot of people, the inability to work anymore or to work as much as they want to achieve as much as they want to around the home, limited by strength and perhaps by shortness of breath, then it makes it a lot harder for you to contribute, and I think that must be devastating for patients.
Scleroderma can sometimes cause quite profound changes in patients' ability to live normally and to perform normal everyday activities, and it can impact on social function and on work, on ability to dress and to cook and do things around the house, and that can be very confronting for patients. Some patients also feel very self-conscious about their disease, and particularly with changes in appearance for women, together with problems of Raynaud's, difficulty getting out. This can sometimes lead to some degree of social isolation as people feel fearful to go out. They might have reduced work participation, and this can in turn lead to low mood, low self-esteem, financial pressure, sexual dysfunction, and a number of problems for patients which are really very important to address in addition to the medical problems. So scleroderma is a rare disease, but one which, when it affects people, affects them quite profoundly and can affect a number of organ systems. Families of patients with scleroderma can really help by supporting their loved ones through this disease. It can be a really difficult disease to manage. It requires a lot of understanding and support and help, so that's really important. One of the other really important things that patients and their families can do is both to help with fundraising, to raise funding for things such as our scleroderma nurses, who provide a great resource for patients with scleroderma, as well as providing funds for research, of which there's much more that we would like to do.